Welcome to AA Home Care's Washington Legislative Conference Issue Education. I'm Tilly Gamble with AA Home Care. Today's presentation is about 40 minutes of information, followed by an opportunity for questions. You can ask a question at any time through the chat bar, but we will hold the questions until the end of the presentation unless there is a need for clarification immediately. We are using a new platform module, so please bear with me during the slide and video transitions today. This program will be recorded, and you will receive the recording and a PDF of the slide deck in the next 24 hours. Today, we have Tom Ryan, President and CEO of AA Home Care, along with Jay Witter, Senior Vice President of Public Policy. They will walk you through information that will prepare you for a day on Capitol Hill. If you will not be attending the Washington Legislative Conference, we hope this information will give you the tools to reach out to members of Congress in the next few weeks to underscore the importance of the issues discussed with legislators and their staff. And now I will hand it over to Tom.
Thank you, Tilly. Appreciate it. Well, good afternoon, everybody, and welcome. Thank you for being here today. Again, whether you've joined us at the Washington Legislative Conference before or whether this is your first time plugging in, the fact that you're on the call tells me something important. You care about more than your business. You care about the patients who depend on you. And you understand that the decisions being made right now in Washington will determine whether those patients can get the care that they need at home, where they belong. I am proud to be leading the American Association for Home Care team. AA Home Care has hosted decades of legislative conferences over the years, but it is really you, through your face-to-face advocacy and passion, meeting with your members of Congress and putting a face to this great industry. It is a pivotal moment for our industry. I want to be direct about that. The release of the DMEPOS final rule was a milestone, and yes, we can point to some real wins in that rule, certainly making sure that the legacy products were not included, but it also marks the beginning of a new chapter, one that demands that we be more organized, more vocal, and more present on Capitol Hill than we've ever been. The next round of competitive bidding is coming. The flawed framework that has threatened our industry for years hasn't gone away, and new pressure on reimbursement, on patient access, and the very sustainability of your businesses are not waiting for us to be ready. They're here now. I wanted you to think for a moment about not about policy language or reimbursement rates, but about the person on the other end of what we do. The patient who gets to stay home because you deliver the right equipment. The child with a mobility need who can get to school. The senior who can breathe at night because of the oxygen that you provide. The person with the diabetes managing their condition with a CGM that you supply. Every bill we're fighting for in the next week in these congressional offices, the DMEPOS Relief Act, the Choices for Increased Mobility Act, the SOAR Act, these aren't just acronyms, they're lifelines. And we are the ones that must make Congress understand that. Here's the truth about how policy gets made in Washington. Lobbyists have a relationship, but nothing moves a member of Congress more than a constituent who shows up and says, this is what's happening in my community. This is what's happening to my patients. Last year, more than 120 HME stakeholders walked through the halls of Congress, and Congress heard us. We built momentum on bipartisan legislation. We kept key issues front and center. One of it would have been very easy for them to slide off the agenda. This year, we need to be louder. We need to be bigger. And we need every member of Congress to hear from someone in the HME community, because when they do, things move. Next week, on May 13th and 14th, our industry comes together on Capitol Hill. You will walk into offices, some of you for the first time, and you will be the expert in the room. You will be the person who can explain from experience why these policies matter. AA Home Care and our partners at Advocacy Associates will make sure you walk in prepared and you walk out having made an impact. Whether you're a seasoned advocate or you've never had a meeting on the Hill, I'm telling you, your presence matters. Your story matters. Your patient's story matters. Today, Jay's going to walk us through the specifics of the bills, the status, exactly what we need to say and who we need to say it to. So listen closely, take notes, and come in next week ready to use this preparedness that we're going to get you done today. I said this is a pivotal moment, and I mean it, but pivotal moments only become turning points when people decide to show up. You're showing up, and that means everything. So thank you. Now, before I turn this over to Jay, we have a short video of Craig Ray, a great advocate and supplier from Penrod Medical.
Hello, everybody. I'm Craig Ray. I'm a regional DME provider in North Carolina with Penrod Medical Equipment. I've been attending the legislative fly-ins pretty much most of the years for the last 15 years. I think it's very, very important. And on top of that, it's going to be something that's really fun to do. The best part of this is AA Home Care makes this easy. Today's webinar is going to give you all the objectives, all the education that you're going to need to be fully prepared to meet with the legislators and their assistants. And once you get there, they're going to have resource materials, all the background information you can imagine as leave behinds that you can leave with the legislator or their staff. Before we get there, all the meetings are going to be scheduled. So all you have to do is show up, prepared to do a little walking because those congressional office buildings are pretty big. We go from one place to another. You'll be paired up oftentimes with people from AA Home Care or other providers in your state. Before you get in, meet with them, discuss who's going to take the lead. That's an important thing to do. I've always found that when anybody from AA Home Care is in the meeting, they are the best people to present that you can imagine. But don't let them take solo because the lawmakers want to know what's happening on the streets. They want to know your experience. So you got to make sure you chime in and bring with you lots of examples of how changes at Medicare are going to affect your patients, their constituents. I found a few best practices over the years. Number one, I've learned that the legislators really don't care about us. They do, but we're not nearly as important as the constituents and the patients. So frame everything that we ask for, how it's going to affect the beneficiaries, especially in rural areas, because rural areas are often underserved and legislators seem to have a pretty strong focus on that. Once you get there, do the introductions. Tell them the area you serve, frame it as much as possible how it affects their voter base. Okay. Also start with a background of DME and what we do. Let them know that we're the people that keep the patients in their homes. We save them money. We're the good guys. Tell them about the state of the industry. Tell them what's happened, how we've had nearly 40% of providers go out of the business since Medicare implemented the competitive bid program. You can talk about access issues, especially in the rural areas, it's still a big thing. So the other big thing you want to do is make sure you describe the asks. Talk about why you're there. You want that legislator to either co-sponsor legislation. You want them to sign on to a letter. You want them to vote in favor of legislation. Tell them why it's important. Most important thing you can do toward the end of the meeting, I call it AFS, ask for support. They're going to ask, what are the asks? Tell them, we really need you to help. Without it, our patients are going to suffer. So other guidelines, kind of simple things, dress professionally. Washington, D.C. is a coat and tie kind of place. I really think you have a little more credibility if you're wearing a jacket and a tie for men, business dress for the ladies. Okay. Be very courteous during your meeting, get business cards, and, try to establish relationships with those people that you meet with, because it's not uncommon for, say, you meet this year with a legislative assistant that's, working for a newly elected congressman. Well, next year, that same legislative assistant, excuse me, might be the assistant for a senator on an important committee, finance committee, whatever it might be. So build those relationships. After the meeting, make sure you follow up. A week, 10 days later, send an email. Get business cards when you're there so you have all the contact information. Send an email, give them a phone call. Say, hey, I'm just following up on our meeting. We sure appreciate your time. Can we count on your support? So most of the time, you're going to find these legislative assistants are pretty well prepared, and that's good news. I've never found one that wasn't friendly to the cause. Every one of them wants to hear what they can do to help. So with that, Have a great legislative conference. I hope to see everybody coming up next week in Washington, D.C.
I think we can move the slide up for Jay.
Okay.
Well, thank you. I hadn't seen that video before, but Craig, hit a home run. Exactly. You can tell his experience throughout the years. So, I think he provided a great guide, and certainly to emphasize the point that Home Care is here to make it easy for you. The political process, the political landscape can be very tenuous and complicated, but we try to sort through that. And as Tom had mentioned, the most important thing is for you to tell your story. You are the experts of what you do, and it is about building relationships. But before you come in, I'm sure you watch the news about the political environment in Washington D.C. It's certainly challenging. We have a new administration, but there's, President Trump was president before. We have new political staff in all the big departments and agencies, which we immediately tried to, reach out and talk to those folks. And it has been a challenge up until recently. But it was, political pressure, our friends with Congress, the White House weighing in. Certainly, that was a challenge. It is an important window to educate the new folks. We do, as Craig mentioned, sometimes people move up or move to the side and they know our issues, but there's a whole slew of folks that don't know our issues, and you'll be shocked on how little they know. So certainly it's an opportunity um, to educate them, build relationships, and also, and we strongly recommend this, is becoming partners. We certainly mentioned that to CMS, to the White House, to Congress, that we want to be a partner in working through these complicated issues. You've also probably noticed in the news the slim margins in Congress. So we do have a Republican controlled Washington. President Trump's Republican, the House is controlled by Republicans, and the Senate is controlled by Republicans, but by very slim margins. And sometimes it changes day by day. Currently in the House, there's only a 2-seat margin. In the Senate, it's 3. So it is very tight. And I know in the past we've always said how important it is to make connections with committees of jurisdiction. But in this environment with such a slim majority on both sides, every member of Congress is important. So if your member is not on a committee of jurisdiction, whether Democrat or Republican, their leaders need their votes. So it is so important for everybody to really push their member of Congress to support. There is some we've had some difficulties. The last week there's quite the battle on DHS funding, future appropriations, budget reconciliation. There was a FISA issue. So there is a lot going on, but we are hearing rumors from very good sources that there may be an opportunity for healthcare legislation in the near future, either before or after the November election. So there is certainly potential for our legislation to move, and we'll get into our legislation. We have, well-established legislation, and we have some new bills coming forward. So it's a great opportunity for all you to come in. And like I said, there's a lot of new staff. There's a lot of new members. Um, this is the time to help them help us and educate them, build relationships. And certainly, I will say, even if you have a negative meeting, that's a positive as well. And it's good for you to know. It's good for us to know if there are challenges or work that we need to do. And certainly, as a constituent, you can keep that in mind, in November for the House elections. Next slide, please. Next slide, Tilly. There we go. So we'll go through some of the bills that are established, and we've been working on this legislation for numerous years. It's to provide the 75-25 blended rate in non-rural, non-CB areas. This legislation, through our friends in hard work and great support, passed into law twice, and really was poised to pass into law a third time. But because of the dysfunction in Washington, really very little healthcare bills have passed, in the last couple, 2 to 3 years. So we are poised to get this legislation passed. In our discussions in our publications, we have focused on, the final rule, because that's certainly an important issue. But we have continued to work this issue. I've been to a number of the states. This continues to be an important issue for members, and we have great champions. We have great legislation. The legislation, both in the House and Senate, have cleared the committees, and is really, we have a CBO score. A lot of you folks will be like, oh, okay, what's the CBO score? The bill has been scored multiple times. The last score we had was 218 million for the relief, which is, sounds like a lot, but in Washington terms, it's not. And this is something, Tom testified about the House bill early in January, which indicates the committee's great support. And we've recently, one of our members, their lobbyists, talked to Chairman Crapo. He's still fully committed to the bill and has said that the Senate continues to push and is looking for an opportunity to pass the legislation. So it is still viable. We have the commitment from the House in having Tom testify about HR 2005, but also from the chairman. And you all remember the senator from South Dakota, Senator Thune, was the original champion and actually passed this twice. So I'm sure he'll certainly help on the way. But this is an important issue. To answer any questions, this is still viable. It is gone through the committee process. It is House and Senate agreement, and it is so important for you right now to talk about this during your Hill visits next week, to let everybody know this is still in play, and we need this relief very quickly. I will say there's a lot of you out there that do your homework and have read the bill, and the legislation itself would provide relief for 2025, and that's okay. So the bill itself, HR 2005 or S 2951, won't actually pass into law. It will be included in a larger package, and we've already talked to the committees, we've talked to leadership. That date will be updated for a year whenever the legislation passes. So don't worry about that. If House or Senate staff ask about it, you can certainly talk about the legislation will be updated, but there's no need to update the bills right now. We need to continue to get co-sponsors. So if you have any questions about that, certainly let us know. But this is poised to pass into law. And then, fraud and abuse. I'm going to turn this over to Tom. He's done a ton of work on this with the administration and with Congress. So Tom.
Yeah, no, thank you, Jay. Well, I did it alongside Jay. Anytime I'm going to a meeting, whether it's the White House or with Dr. Oz, wherever it might be, Jay is at our side. We do a good teamwork together. So, if you fraud, waste, and abuse is all we're hearing about these days. You continue to hear about issues going on around the country. For the first time ever in this industry, we're under a moratorium, under a 6-month moratorium for any new suppliers that are coming into business. Essentially, it's been put on hold. Now, we want to be good stewards of the dollar. We believe that fraud, waste, and abuse is a real problem with the criminal aspect of, with the criminal rings. It's not really happening with our members and people who are serving this industry. And unfortunately, Dr. Oz, who's really doing a very good job on trying to control fraud, waste, and abuse, and talks very often about the criminal element, he believes that competitive bidding is a fraud tool. And we do our best to convince him it's not, but we had a meeting with him the other day and really wanted to kind of take our hat off to him for the efforts that he's done. He told us stories, and again, every one he mentioned was the criminal rings, criminal ring out of China, one out of Russia, Somalia. I mean, never talking about good suppliers. And he told us the reason that we need to put this moratorium on is because we're finally catching up and working with the Treasury Department. We never had the tools, CMS never had the tools to really do a good job with fraud, waste, and abuse. It was always pay and chase. Nowadays, it's the new phrase is stop and cop. They want to get these dollars in before it happens. And let's face it, when we hear about these major fraud issues, we hear about the $2 billion catheter fraud, which I'm happy to say 90% of those claims did not get paid out. It has some sort of a knee-jerk reaction to some members. And certainly that's, I think, is why we've got product categories like urologicals and competitive bidding. So we've got to do our best to make sure we're good stewards of the dollar. We have worked with both Kim Brandt and Dr. Oz on some proof of concept issues where we're doing claims validation, but we clearly are a supporter of this. Things like, increased oversight of new suppliers we agree with, monitoring suppliers who are new and entering the market. Anytime there's an electronic fund transfer document or a change of ownership, they've got to be looking. And certainly these claim spikes. That's something that they've got to have better technology, and they're getting there. And we've been an advocate of e-prescribing. We've been an advocate of prior authorization. We think these are all very good, usable tools that can help in the fight. So when it comes to fraud, waste, and abuse, AA Home Care wants to be a leader. We want to be a partner, and we want to make a difference. You can move the slide.
And just a comment on that too. You will likely hear about that in your Hill visits. And rest assured, AA Home Care is working with Congress, with the committees, and with the administration on anti-fraud efforts. So if it does come up, we do have materials in your packet. We do have materials on the website. These are not just signing letters and co-sponsoring bills. We are actually working at the highest levels to root out this criminal behavior. And as Tom had mentioned, it just, sometimes it's discouraging to hear folks talk about DME fraud, but they're talking about criminals and not, they didn't talk about error rates or some documentation errors. They are truly going after criminals, and we are joining that fight. Now I'll talk about S247 HR 1703. This is the titanium carbon fiber upgrade bill. This is something I think is just great policy. It has all the good aspects of legislation. It helps consumers. It provides choice. It was already in effect, and CMS decided, well, we just don't like it anymore, and changed it, not through regulation, just with an announcement. And so, this is something that was strongly supported by the House and Senate folks. The bill has been marked up in committee, and essentially, just to give you a little bit of background for those in the mobility sector, is in the Balanced Budget Act, Congress passed a provision to allow upgrades within a code for lightweight wheelchairs. That went into effect. It was very successful. Kara Bockenheimer, some of you all know Kara. She was actually there and part of the process. And then in 2016, CMS decided they didn't like it anymore. And so we have been working to get legislation. We are in the best position we've ever been with this legislation. We are partnering with NCART and the consumer groups, ITEM coalitions, United Spinal, to really give consumers the ability to upgrade within a code and pay the extra to get the lightweight titanium carbon fiber chair. It has a 0 CBO score. The House and Senate language are identical. The House and Senate committees all agreed to the same language, and we have some great champions in the Senate. We have Senator Blackburn and Senator Tammy Duckworth, who uses a titanium or a carbon fiber chair. We have Dr. Joyce and Vern Buchanan, and Dr. Schreier, as a Democrat from Washington, all support this legislation. For those in the mobility sector, this is ripe for passage. We need an extra push to cut through all the noise, and the dysfunction. And the Senate is trying to pass this under unanimous consent or hotline it, which it's an expedited consideration process. But we need to build the noise, and I know the NCART folks are in conjunction with A Home Care. A Home Care fully is supporting this and pushing it. The consumer groups. We certainly need you, if you're in the mobility sector, to talk to your representative and 2 senators about the bill. Next slide, please. There we go, Tom. This one's for you.
Yeah, Jay likes to throw the SOAR Act over to me, I guess, because of my history as a respiratory therapist. And this is one of the bills I did testify on. And it's something that we support. It is a bill that would, it's got a Senate component to it, Senate Bill 1406, a House component to it, 2902. And it is getting talked about at committees of jurisdiction. Jay and I speak about it often. There's a lot of components to this bill. One of the things is to take oxygen out of competitive bidding in perpetuity, which is something that the Hill doesn't always like. They like a time frame on things, but that's what it does in fact do if it gets passed. It will also give a new rate for liquid oxygen. Liquid oxygen is almost like an orphan drug these days. The competitive bidding program really took that product and took it out of the marketplace, and it's going to be difficult, if not impossible, to bring it back in. Had they not decimated this industry with those competitive bidding rates, my feeling is we probably would have had the technology today to do high flow oxygen. But one thing that CB has done is thwart technology. So that's always a point I like to make when I'm talking about the SOAR Act. And it also will do a little protection for respiratory therapists. This is going to be interesting how this could happen, but it would be an add-on payment through CMS for a respiratory therapist. Again, this is why this bill has support from the pulmonary community, the COPD Foundation, AARC, certainly CHEST, the American Thoracic Society. So having all of those groups lined up, with us alongside A Home Care, CQRC, to be supporting this bill is helpful. One of the things that we like very much in it is also the establishment of electronic templates, which would be specific to oxygen. We've worked with CHEST on this, and it's a very simple, and it would provide the medical necessity agreement to the product, but it will not have to go into the patient medical record. As you know now, today, it's extremely subjective when we go into the medical record. We'd rather have an e-prescribed template where all the data is there. So if you're on the Hill and you provide oxygen, talk about this. This is a great bill that got a ways to go. I'm not sure we're going to get it across the finish line this Congress, but certainly it'll be around next year. So talk it up. Thank you. Next slide.
Yeah, and before I get into this is getting into some new legislation. I will just say that the 3 bills that we just talked about, Tom testified in front of the House Energy and Commerce Committee in early January. They are viable pieces of legislation. Tom, when we talk about legislation, doesn't like message bills. And these 3 bills they're viable. The committee has taken action. They're ready to go. So these are not message bills. These aren't like, oh, let's get a co-sponsor to feel good about it. They are actually poised to be signed into law. And we certainly need you to talk about them, build support, and just get us over the finish line. Certainly, some may have more experience with one bill or another. You have the mobility issue, you have the respiratory issue, but certainly take this opportunity. This is well thought out, well supported legislation. And like I said, having Tom testify about these 3 bills was an important move forward. Now we get to new legislation. We'll talk a little bit about the final rule with competitive bidding and kind of the situation there. But there is legislation S 4037. Just give you a little bit of background. The 2 co-chairs of the Senate Diabetes Caucus, Senator Shaheen and Senator Collins, have a diabetes bill that they've worked on for a number of years. We found out that they plan to reintroduce this legislation, and we're thinking about a competitive bidding component, and certainly we'll talk a little bit later. But the strategy is to delay, like we did with the non-invasive ventilator issue, and create a technical advisory panel and a demonstration project and slow the process down. Uh, the Senate staff said that they were introducing the bill, the next week, and I said, well, we have some recommended language. They did include that language, so you can talk about it if you do diabetes supplies, CGMs, insulin pumps. This provision is in conjunction with an overall strategy we'll talk a little bit about later, but this is certainly legislation you can talk about, and it does have a provision that would address concerns with the current competitive bidding program. We do have an issue brief about it. The legislation was introduced about a month ago, so it's relatively new, and we appreciate those who do diabetes supplies to urge your senators to support that. We have some House language, which we'll talk about in a few minutes. But certainly we have an issue brief on this, and we're urging the Senate to support this and move it forward. Next slide, please. So there's the overall, final rule issue, and I don't know, Tom, do you want to start on talk a little bit about that, and then we can kind of go into
Sure, we can.
Some of the the specific legislative efforts.
Absolutely. So these are bills, obviously, that we need to get moved, and our goal is that we know they don't belong in competitive bidding. They're poor product choices to be in competitive bidding, but the reality is they're there. They're in the final rule. So we've got to do whatever we can do on a legislative side is to prevent that from moving forward. So what we look to do is delay the competitive bidding for those product categories for 5 years, set up a technical advisory panel where we can work with industry stakeholders and determine whether or not what's the best way to move forward with these products. But this is something that really concerns me both on the ostomy and urological side as well as CGM side, is that it's the first time I've seen massive consolidation in the way they've designed this program. They designed it with a remote item delivery component to it, which would take 92% of the suppliers today who are supplying these products, it'd take them out of the category because they could not do the bidding. Again, their goal here, and again, this is something we talked to Dr. Oz about. I said, was the goal here to decimate, 92% of the industry? I said, was the goal to make this ridge so large that you had to do it in all 50 states? To sort of scale it where the small businesses and the medium-sized business couldn't stay in business. I said, I got to tell you a story. Again, patient stories. Let me tell you a story about a third-generation enteral stromal therapist in Arkansas. It's Arkansas ostomy company. They're one of the largest suppliers in the state, and that's 3 generations of nurses who are enteral stromal therapists who know what it's like to get the proper bag on a patient and the proper pouching device. And it is just amazing to me. I said that she is going to be essentially out of business because of the way this program is designed. Dr. Oz stopped and said, that was never my intent to have it designed where we would take that many patients out. So I said, well, we need to get your approval. We need to work with CMS, and he told us who we need to work with. And we're prepared to go in and do everything we can on a because this is a very simple fix, sub-regulatory. You could simply just take that RID and make it a much smaller product category. We can take things like ostomy that really don't make any sense to be in, competitive bidding. It's just, there's not a lot of competition from the manufacturing on that side. And it's not, has no history like unfortunately urologicals did with that fraud scheme of massive increases. So just like they took tracheostomy tubes out, that could be taken out as well. So we're going to do everything and anything we can do to work with administration to get that RID program completely designed to do things like through sub-regulatory action, remove some of these product categories, and then, more importantly, work to see how we can somehow through rulemaking, it's going to be a tough one, but if CGMs are going to move forward, get them back into the purchase, from that ridiculous rental category. which got its own issues when it comes to FDA standards, et cetera. So that's some of the work on the side of the administration. But Jay is geared up and ready to go. And I haven't asked him today where those bills are, but Jay can tell you that we're working really hard on some bills.
He'll text me right after this. Yeah. So obviously, we were all disappointed when the final rule came out. It was the Friday after Thanksgiving. I certainly was in a depression, and I describe it as grieving, and I know Tom was in that same place. But Monday came, and we had to, we gave it our all, and we had to kind of shake it off and move forward. And certainly, so we have the two new basically categories in the competitive bidding, and Tom certainly talked about the concerns, but you have CGMs and insulin pumps, and you have urologics and ostomy. Same issue. They shouldn't be in competitive bidding, but really different arguments in different constituencies and different champions on the Hill. So we talked it over on that Monday, and you all remember CMS tried to do this with non-invasive ventilators. In 2016, CMS decided to include non-invasive ventilators in the next round of competitive bidding. We thought that was dangerous. Vent patients, if they go without vents for 24 hours, they could die. And so we worked with the administration, as Tom had mentioned, we're doing now, but we also worked with Congress on legislation to address the issue. We worked with Congressman Griffin, who is now chairman of the Energy and Commerce Health Subcommittee, and Congressman Welch, who is now Senator Welch, on legislation. And it took us about 6 months to kind of hammer out a bill that was acceptable to the committees. It didn't have a cost issue that the consumer groups, the suppliers, manufacturers, clinicians all could agree to. And that was to delay the implementation for 5 years and have a technical advisory panel. That legislation was very successful and got 60 or 70 co-sponsors. The committee supported it. It really gave the industry a tool to push back. And as we all know, in 2020, CMS decided to pull NIV out of competitive bidding. So the path was already there. We were successful in getting NIV out. This is a very similar situation. And so we started formulating a strategy to have legislation. And the first discussion was, do you have one or two bills? And, I asked, some of our ostomy folks, do you want to talk about CGMs? And they're like, no. I talked to some of our diabetes suppliers. I said, do you want to talk about ostomy? And they're like, no. So the issue of having two separate bills was agreed to pretty quickly. And the most important thing, and what we had with NIV, was industry consensus, stakeholder consensus. So we immediately started working with the consumer groups, clinicians, suppliers, manufacturers on that strategy. And the urologic ostomy folks agreed to it pretty quickly, and we started moving forward. The CGM insulin pump folks have recently agreed. Everybody's agreed to that strategy. So we are actively seeking legislation for both urologics and ostomy and CGM and insulin pumps. We are working, as Tom had mentioned, he talks to me at least 2 or 3 times a day. And we are doing everything we possibly can to get these bills introduced by the time you come in. But we are hearing there's a backup at the House Leg Counsel's office. So what we're preparing, and we've done this before, the night before we make an announcement about a bill or a bill number, but stay tuned. But we wanted to make you aware, and you can certainly talk about the final rule and concerns about it. And we have great documents about that. And you can let your House and Senate folks know that bills are coming in the near future to address the issue. And then once the bills are introduced, you can follow up. It's a great follow-up. Hey, I talked to you in May. I told you about this important bill. The bill is now introduced. Please co-sponsor and support the legislation. So just to let you know, that's kind of the new legislation that is got stakeholder support, and is really rock solid strategy, and has worked in the past. We even have Chairman Griffith's staff, wanting to help out, talk to the other sponsors, to give them advice on how to get the bill moving forward. So it is a great effort for those who are in those two sectors. Talk about the problem in the final rule, and then tell them that legislation is forthcoming, and it's a perfect follow-up for all of you once the bill is introduced. And we will provide you minute by minute updates, and I assure you, Tom Ryan will keep pressing until we get that bill introduced. Next slide, please.
Thank
Yeah,
you.
and then the Medicaid. Tom can. I'm a federal guy, so Tom can handle the Medicaid side.
Well, yeah, obviously, Medicaid has been under attack. The big, beautiful bill had a big, beautiful $1 trillion cuts to the Medicaid program, major changes in eligibility. And our biggest concern is that a good deal of the patients who require DME do have Medicaid access. And if we see these states who are going to be having budget issues because they're losing some federal dollars, beginning to make cutbacks, we want to make sure that DME is not part of it. We've got to continue to talk about how important that patient community is to you as a DMEPOS provider, how critical it is that those patients are cared for with the technology that we provide in the home. Again, cost preferred, patient preferred setting in the home, and make the case for making sure that Medicaid dollars are not cut when it comes to DMEPOS. Our challenge is that most of the Medicaid programs rates are really not adequate. They've got to be increased. We certainly don't want to see them cut. We're working very hard in the states on rate floor legislation. What we don't want to see is rates go backwards. Laura Willett, our senior VP, who handles the payer relations, along with David Chandler and Katie McGonigal, that they are doing a very, very good job in advocating in the states. We're also seeing in the Medicaid programs the same thing we're seeing on the federal side with the moratorium. Several states have had moratoriums. Florida is one. Laura's well known in Florida. She was down in Florida a couple of weeks ago testifying, meeting with the governor, and doing all the right things to make sure that when it comes to any moratorium, that the good eligible suppliers who continue to want to grow are able to continue to do business. So more and more, we're going to hear about Medicaid, and we'll be up and ready to go. So if you check on our website, and we'll have good material for you when you're in town next week, to just put a word in for how we are a supporter of where patients want to be and how important the DMEPOS is to the budgets of these Medicaid states.
Yeah, so as we said, act now, tell your story. You were the expert at it. And I wish, Tom and I wish we could see your faces, but we feel your support through the internet, and look forward to seeing you all next week. But certainly tell your story, tell your experience, your recommendations, and certainly push for the legislation that we have talked about, the 7525, the SOAR Act, the titanium carbon fiber bill, and anything we can do to help. We're here to be a team and do this together with you. So next slide, please. And it is my pleasure to introduce Advocacy Associate video. I will tell you, as the staff can attest, I'm a paper and pen guy. I'm not a technology guy. You won't see me on social media. And certainly when we started working with Advocacy Associates, I have my own way of doing Hill visits and scheduling. And so I was a bit skeptical, but I tell you, they knocked my socks off. This is a great app. It's a great organization, very professional. The app is phenomenal. The information that I need, the information that you need. And so they've prepared a video to kind of help you through the process. So with that, Tilly, start the video.
Just get better and better every year. It's terrific.
Yeah.
I already fired mine up, so it's working well.
Next
We,
slide, Tilly. Oh, there we
yeah,
go.
we have lots of questions. I'm going to go ahead and turn it over to Gordon at this time. And I know Gordon was going to mention this, but we have already sent all of those emails out with your meetings. So I'll let Gordon just go ahead and step in now.
Thanks,
Yeah,
Tilly.
thank you, Tilly. Yes, that as referenced about the specified date they were going out. Advocacy Associates told us they sent those out about noon today. So if you didn't see it, look in your spam filter, and we'll, if you have additional problems, you can reach out to me. My email will be in the follow-up email that we send with the recording of this, and that's the one of the questions we did get. Is this being recorded? It is, and we'll be sending you a recording and the link to our various issue briefs and materials, depending on when the recording gets finalized, probably late today or early tomorrow. Okay, and with that, here's some questions we've gotten. Okay, my first meeting is on the Senate side at 10 a.m. What time should I get to the building entrance to get to the meeting on time?
That's a great question, and we're seeing, Tom and I are up on the hill all the time, and it changes constantly with new security threats. We have, sometimes the president or administration going to the Hill, or diplomats. So I would recommend getting there at 8:30, 9 o'clock. Go grab a cup of coffee if you're a little early, but particularly if your meetings are early in the morning. The lines have been horrific. I'm talking about 10, 20, 30, 40 people in line. So that's my recommendation is, if you have a 10 o'clock, I would get there, 9:15, and I would build in time for Ubers and lifts. It's pretty tough to get a lift in DC anymore, particularly when Congress is in session. So kind of build that into your schedule.
Okay, and that person also asked, how long does it take to walk from the Senate buildings to the House buildings?
Depends on how fast you walk. I would say 10 to 15 minutes if you were, go at a good stride. But you do have to go through security again. It's not like the old days where you could go underneath. So it is a straight shot, 10 to 15 minutes. But you will have to go through security again. So please build that in. Anytime that you're running late, it happens, right? So somebody, the speaker or somebody, the president's coming and they shut down and you have to walk around. Is if you're going to be late, certainly use the app to indicate to Advocacy Associates you're running a few minutes late, and they'll notify the office.
That's great. Actually, that was one of the questions that later that we had. What do we do if we are late? So thanks for
Tom and I have that all the
that
time. So we usually have, sometimes we have to go back and forth 4 or 5 times from the House to Senate side. And sometimes, if you have a very productive meeting, it's sometimes hard to cut that off. But certainly respect the time of your next appointment. Contact Advocacy Associates. They will text the congressional staff or member, and they'll understand.
Okay. And then I just got one more very related question to that so I'm going to move to the top of the queue. My meetings are at 10:30 on the Senate side, then 11:30 on the House side. Will I have enough time to conquer these meetings?
Yes, you should be, unless we get a snowstorm or something.
Yeah.
You should be fine.
Yeah.
So your meeting,
Tom,
you'll be over by 11, and 30 minutes from the Senate to House or House to Senate is plenty of time to walk over and go through security. Now, if you're running super late, this is an option that some folks take. Is there'll be cabs out on House and Senate, and they are used to going back and forth. That will significantly reduce your time from 10 to 15 to 5 minutes. So that's an option if you're really running late. Most of the buildings have cabs outside, and you can just tell them you need to go from Dirksen to Hart, or Dirksen to Rayburn, and that's a good option. And it'll cost you like $6 or $7.
And just to add, we very commonly make them, an hour between from Senate to House. So that is
Yeah.
absolutely normal. Okay. Next question. Is the normal process to hit all the legislative staff with all of these bills and issues at once, or do we pick certain ones to focus on for certain reps?
Well, I would certainly recommend what your expertise is, what your focus is. I recommend using the chat app and talk to other people in your group about who's going to lead, who's going to take each issue. Obviously, if you get 10 to 15 minutes, it's hard to get through all the meetings. But what we have is we have all the documents, and we're going to provide you a QR code in the packet that the staff can have access to all the documents that you have electronically, which they love. So don't feel bad if you can't get through. Don't rush it. You can always follow up with that staff, and it's like sales. Anytime you get 2 or 3 bites at the apple is better than one. So use your judgment, talk about what you feel comfortable with, leave the information, follow up with that staffer if you can't get to some of the other issues, and that's a good way to build a relationship.
Okay. How do I respond if a staffer pushes back against what we're requesting?
So certainly, they can and will often have questions, or some may not support your position, and we respect that. And certainly knowing that is helpful. You don't have to get into an argument if you have a tough meeting, or if you're asked a question that you don't know the answer and not 100% certain, you could just be truthful in saying that. So if you don't know the answer, you can always say the AA Home Care will follow up, or you can follow up with our help. If they are just opposed, you can let us know and we can follow up. But certainly remember that in November, if they can't find something on the list to support you, they're not going to support you. And so remember that in November. But good meetings and bad meetings are all important. Information and sharing, that's how we win. So if you get a tough meeting, don't get upset, don't fight it. Give us a heads up, and we'll take that office on.
Okay. A couple people have asked about printed materials. Are there printed materials that we can leave with staff? Where do we get those? And can we leave our own documents with them?
You know better than I, Gordon. So there will be a packet of information, and that we can have available at the dinner or at the hotel that morning. We've provided, Gordon and Tilly, and the regulatory staff, Kim and Mina and Kara, they've all put together great documents, and we want to make it easy. Some staff like leave behinds, other staff like it electronically. So we do have a QR code that they can take a photograph and get access to all of our information. You will have printed documents that you can leave behind.
Right.
For some reason, if you run out, we can certainly follow up with that staff and send information on your behalf.
Yeah, and I believe they have access to the materials that are for their meetings. They have access to our
Right.
materials through the app as well, the office. So
Yeah, the app is loaded up. I was just on it. All of our one pagers are on there. They're terrific.
and like I said, I believe they have, because the staffers get a link to the materials as well. So
one piece of advice, and this just recently came up. Don't think you'll be able to print any documents on the Hill at Kinko's, or there's no resource to print documents, but you can certainly leave documents if you have something from your company, or a patient letter, or like I said, follow up. But as far as finding, your hotel is probably your best resource if you need to print things out. That's just the Hill doesn't have a lot of printing companies that are walking distance.
All right. Next question. If there's going to be a couple hours between meetings, where should we stay in the building? If so, where?
So all the buildings have cafeterias, and a lot of times you can go to the cafeteria, get a cup of coffee. You'll see other folks. You might see us. So any kind of downtime, each building has a cafeteria where you can grab coffee and kind of catch up. And certainly you can see other people or even a home care staff. We make the rounds to answer any questions.
Okay. Next question. Do you think we'll be able to get the moratorium on new locations lifted? Can Congress help with that?
You could
That's a
certainly
top
let
question.
Congress know about that. We have pretty much reached out to Kim Brandt to get verification of our face-to-face meeting we had with Dr. Oz and with Kim Brandt 2 weeks ago, where it was mentioned that the intent was never for a reputable supplier looking to have, de novo growth or growth through acquisition be put in a position where they couldn't move forward. So if you have an issue going on with that, I would suggest you reach out to us, reach out to Kim on our team over here, who's got a good relationship with Kim Brandt, and we'll do our best to be a mediator to resolve that problem. So still waiting for the written response that we could give to the industry, but if you're having an issue, work with AA Home Care and Kim, and we'll see if we can best get it resolved for you.
And we do have a document that explains the moratorium and our position. So you can always use that as a resource as well for the Hill.
Okay, hold on a second. Okay, I'm the only person in attendance in one of my meetings. Can I get other people to join me?
Sure.
Yeah, put myself or Jay in if you want. You like.
Yeah, and we have consultants as well, Mitch Vakarix and Brett Baker, that may be available. So reach out to Gordon, and we'll be working with Gordon as we move closer. But certainly, whoever asked that question, just reach out to Gordon, and we'll plug in somebody with you. You don't have to go solo.
And you might also be able to, discuss with some of the people at the dinner on Capitol Hill the night before. You might, if you know some people, that might work out as well.
Yeah.
Okay. Let's see. I'm sorry. There's one more. We do have a comment. Someone said, "Be sure to bring your umbrella." I don't know if they or looked at a weather forecast or if that's just the.
That's always good
experience.
advice. And comfortable shoes.
Okay. Here's the last question I've got is, when is CMS going to share details on the bidding process for ostomy and urologicals? I sure hope we get this delayed.
I sure hope we get it delayed too. I mean, the timeline is that we're probably going to be seeing something later in the summer or in the early fall, potentially, reaffirming the product categories. So we're expecting something coming soon. That's why we need to get our meeting accomplished very, very quickly with our top politicals at CMS to look to see if we can't get some changes done. But I would say by the end of the summer, likely.
Okay.
And I agree with you.
That's all the
questions. I hope we get it delayed. I hope we get our legislation out. And the only way we're going to get that accomplished is if you go in and tell your story. So thank you for being a part of the fly-in and willing to take that responsibility on. It's noble.
Okay. Well, for anybody who got on late, we're going to be sending a recording of this to everybody along with our materials. I believe it might be later today or by tomorrow morning. My name and info will be on there if you don't already have it. If you want some further discussion about your meetings, and if you look at the meetings you've gotten so far, you might see that maybe only half of them are set right now. It's very common. We're getting more of them locked down every day, but some offices just aren't going to schedule until the last moment and until we've poked them a few times. So that's very common. So Tilly, do you have anything else to add or?
No, I just want to say thank you to Tom and Jay and Gordon and everyone for joining us today for the webinar. As the legislative conference draws closer, AA Home Care will share further talking points and resources with you to help you make the most of your visits in DC and outreach to staff. So stay tuned for those. We have more coming, but a lot of those will be in the email that we will share, as Gordon mentioned, and then we will have the folders, which are leave behind folders for everyone for each office visit on the Hill next week. Any final words, Tom, Jay?
No, thank you very much. Again, you got to be part of the fight, and you're in it. I'm proud of the fact that you're going to make this a priority and come into town and tell your story. And like I say, it's that individual story that makes a difference. And that's what moves the needle. So thank you.
Thank you.